Now we're going to stick with COVID-19. It's time for On Point, where we speak to experts to delve deeper into the biggest news stories in the spotlight right now. As we've just been hearing from our Shin Ye-eun, South Korea's new COVID-19 cases have been in the 2,000 range for about 5 straight days. This also on Sunday, and we expect similar numbers when today's figure comes out. There are also growing concerns that we are seeing a resurgence after the government relaxed virus-related curbs last month under its Living with COVID-19 scheme.
For more, we connect to Dr. Alice Tan, internist at MizMedi Women's Hospital in Seoul. Good morning, Dr. Tan.
Good morning.
Well, doctor, some are saying the government should have waited until after Halloween to start the scheme, as many people gather late into the night, drinking in bars and many other places. Do you think the decision was an oversight, and can we say that the gatherings directly led to this resurgence?
Well, it doesn't appear from the contact tracing that's been going on that Halloween was a major factor in the resurgence. My concern is more with, I would have preferred that the opening happened after we had a higher uptake of boosters among the elderly in Korea. What we're seeing now is clusters, outbreaks in nursing homes, convalescent hospitals, senior care centers. For example, one of the largest clusters, active clusters right now, is a convalescent hospital in Changwon, where cases are now close to 300 from that one outbreak alone. Since November 1st, we've seen greater than 4,500 positive cases in people greater than 60 years of age. And so from that, we can predict that there will be at least 50 deaths, maybe 100 cases that will need ICU care. And so in my opinion, even though there was a large amount of mixing and gathering over Halloween, that's not the driver of the hospitalizations that we're seeing. It looks like it's more waning of immunity and outbreaks in nursing homes and convalescent hospitals.
Now, Doctor, some experts are projecting that South Korea could see several thousand new cases a day in the coming weeks. How likely do you think that is, if it does happen, and if that potentially does become the case, would the government then have to, in your opinion, reimpose restrictions?
Well, even the government has predicted that we will be seeing more and more cases. And so over the weekend, they issued a mandate requiring private tertiary care hospitals to designate more of their beds for COVID care. About, I think, 400 ICU beds and 700 general ward beds were secured as a result of this mandate. And so certainly the government is anticipating an increased surge in cases. And so their first strategy is to increase hospital capacity. At some point, though, if hospital capacity is saturated, we will have to, if needed, think about imposing restrictions.
Yes, and Dr. Tan, South Korea has a vaccination rate in around 80% now, and with this in mind, why are we seeing as many cases as before?
Well, even though 80% is a high number, if you look at it in reverse, that means 10 to 11 million people still lack full immunity against COVID-19. And then the second issue is with breakthrough cases, we see evidence of waning of immunity, especially in the high-risk groups that were vaccinated first. And so that's why we're seeing still numbers in the 2000s. Of course, the lifting of restrictions also causes an increased risk for spread of the virus in the community. So it's really all of these three factors put together, just a large pool of not fully immune people, waning of immunity, and lifting of restrictions. That's what's causing the numbers to stay high.
And finally, before we let you go, discount coupon programs aimed at boosting private spending are set to be released on Tuesday, so people can book cheaper stays at hotels or resorts. Considering the surge we're seeing, do you think that particular plan should be put on hold? And also, according to the data we have, do we know for sure that hotels and resorts are generally hotspots for these cluster infections?
Well, you know, in general, and I would say anecdotally, but also statistically, the hospitality industry in Korea has done really a superb job at stepping up their standard operating procedures to be in line with what needs to be done to protect infection. That being said, anytime there is gathering, mixing, especially when masks are doffed, taken off, that's going to increase the risk of spread. And so in terms of hotels, rather than single unit families going in for vacation, I think the bigger risk is when you have big wedding banquets, babies' first birthday parties, large gatherings, conventions. These are the bigger risk factors rather than, say, one family unit going and staying in one hotel room, eating just within their one unit. That's not going to pose as high a risk. It's really the larger gatherings that are the cause, and in the past, they have been the cause of outbreaks.
All right, Dr. Tan, again, like always, thank you so much for your insights. We appreciate you making time for us.
Thank you.
Thank you.